Hello friends, what we learned from SCR Workshop, our second workshop, this is our second workshop, and the highlighted tool was the mental state. Group learned that how the mental state is interconnected with the LST and how it's help us to understand the TFCR model of Dr. Dhawale sir. From that we understand the different shades of the emotions in deep and how it's correlated with the patient's words. Group learn that the emotional state and intellectual state and how the unbalance happen, and we can understand more that the individualization can possible through the mental states, and when we understand the shades of the emotions, qualitative aspect of the emotions and the interconnected aspect of the intellectual states, like as the motive, will and drive, and how it's understand the capacity, capability and the block. From the both cases we have the two cases. In one we have the intellectual hypertrophied person and emotionally hypotrophied person, and second case was the emotionally very charged up person female. This both case giving examples that how can we understand and how can we integrate the mental state in a depth. Then we going towards the analysis. Critically we analyze the each symptoms. We understand that how the analysis help us in evolution, and then the difference between the qualitative aspect of the prescriptions. We learn RREF in depth, and lastly we learn that why our medicine, if the medicine is come in our repertorial result, but where we are missed, why we are not able to comprehensively understand that this is our remedy, how our life and living and our prejudice affects us. Like as in one case, if in my childhood I am a cowardized child, or because of my father is very aggressive, how it's reflect in my action. Like as in my repertorial result, lycopodium comes 1, Naxumika comes in second and third remedy, but my prescription was going towards the Naxumika because the patient in childhood, he is giving reply to the father and stand with the mother's problem. So that my understanding was that the personality is very courageous, and this courageous comes in a LST because of my interpretation, my presentation, and this courageous comes in a ET in high level. So this type of revisit towards our own prejudice, know thyself, happen through the SCR workshops, unfolded us our own life, and know thyself, know, and then healing us our own self, and then we can heal others also. With that, and also we understand the qualified aspect of the every symptoms, that how the each symptoms having its our own implementation, like as impatience coryza with. In second case we have a symptoms with the impatience coryza with. So how we can select our symptoms, how can we select the rubrics with the understanding of the right symptoms, and properly individualization happen, and we can select proper simile and right potential. It's a very good workshops, and thanks to Bhavik sir and Praveen sir that they are taking the charge up of the mentor of the Raipur Homoeopathic Study Circles. Thank you sir, and thank you to ICR methodology. It's really very grateful giving us an insight, and discipline came after the regular working. It's really very nice, and if this discipline happens in our prescription, definitely our practice will improve day by day. Thank you sir.